Hi there. Thank you for joining UnSCRIPted. I'm Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at the school, all working towards a shared goal of solving the world's most pressing healthcare challenges. I'm excited for you to hear unscripted stories of faculty, staff, students, alums, and partners. Today, I have invited Tiffany Barber to my office, owner of Hillsborough Pharmacy. Welcome, Tiffany.
Thanks for having me.
Great to see you today. Great for you to be here.
Thank you.
I want to know your pharmacy journey. So can you talk about how you chose pharmacy?
I was a chemistry major and wasn't sure what I wanted to do with that. I actually met a pharmacy student at a Kappa Psi party and thought that seems very up my alley. It seemed right where I wanted to be. So I changed majors the next day and applied and got into pharmacy school. I was worried that, just such a change without even thinking about it would be something that I wouldn't enjoy. But for the first year of pharmacy school, I started working at a local community pharmacy, and I knew right then that was where I was meant to be.
What was it about pharmacy when you had that first pharmacy experience that connected with you?
I loved medicine. I love the science behind it. I love everything that goes into it and how it changes our bodies and our minds and what that does for people. But then I never wanted to be in a lab. I always wanted to be people facing and enjoyed talking to them and solving people's problems. So as soon as I was able to get out in there and actually practice what I learned in the book knowledge and make it and see what an impact you could do, that's when I knew that it was right.
Yeah, that's terrific. Tell me about a favorite experience or class or faculty member, a memory that you have from here.
I did always love Shrewsbury's lab.
Okay.
I really liked compounding. We compound at my pharmacy. Not a bunch of things, but your normal stuff. And it's good to see how you can change something so simple and make it for a pet or for a kid who can't swallow a tablet, to make a flavor for them, to be able for them to ingest their medicine.
Pulling together the art and the science. Which
exactly.
Is,
Exactly. My kids are always like, it's like cooking. I'm like, yeah, kind of.
Yeah.
But I really enjoyed everything that I did at the pharmacy school. I really loved OTC. And I always, it's the first thing I ask my students, like, what did you think about your OTC lecture? What did you get from it? And we have a whole sheet that we go through. This is what, in OTC world, these are the things you're actually supposed to ask them. In the real world, you have about 30 to 45 seconds to say, what's going on? What have you tried? Any big medical conditions? Okay, here's a recommendation. So to be able to take what you practice in lab and at school and actually say, like, okay, now condense that, make it work for you and your patient.
Yeah. So you bring up an important point. Our curriculum, one of the things that I think sets us apart in our school is the fact that our students are learning in the classroom, and then the next week they may be out on rotation and then coming back into the classroom. So applying what they've learned in the classroom in a clinical setting, and then taking that context of the clinical setting back into the classroom with them. Are there other things that you think set the pharmacy school apart from others?
I think that here I had so many opportunities to do so many different things. And it was going in not knowing much about pharmacy and what you could do as a pharmacist. I was very naive and thinking, you do hospital or you do community. But the pharmacy school really opened up my eyes to there's so many different things you can do with your pharmacy degree, and so many different passion and different areas. Being able to have those kinds of connections and that background that you have, that a variety of different healthcare professionals, really helps you when you get out there to be able to interact with them and to be able to make the most of your degree.
Yeah, that's really important. Interprofessional education is particularly important for us. And we're very blessed at UNC Chapel Hill that we have all 6 health profession schools just right all together and around us, and having the students being able to work in team-based care. So out of all of the opportunities that you were exposed to, you chose the community pharmacy path. Can you talk about your journey in community pharmacy and having that as your career?
I knew pretty much once I started working at a community pharmacy that is probably where I wanted to go.
Mm-hmm.
And when I was in Greensboro AHEC for a 4th year, and I went on fantastic rotations. Pediatrics, mental health, substance use disorder, all these things that weren't even starting towards when I was graduating these many years ago. And I thought about doing something else because I liked everything almost every one that I went to, but community pharmacy just is in and of the essence of everything. So I can get pediatrics, I have mental health, I have OTC counseling, I have hospital transitions of care, I have chronic care management, we have diabetes, we have heart disease. All of that comes together, and people need somebody that can be able to get that together and do that for them. It's so essential for not only patients, but I feel like we're also helping our providers in our area, because they have such limited time to spend with patients, and how can we maximize that time that they're able to spend with them, so that they can also get to the root of their problems and help them. So we are all constantly working with our doctors' offices and our providers that are close by to solve issues. I think community pharmacy for me is a be-all and end-all. Not only is it great to have personalized medicine, but also we're the only healthcare professional that you can walk in and talk to and have a conversation and get really good advice. And we're constantly, not only are we doing things that are prescription based, of course, and over the counter, but also whatever our community needs. I mean, during the pandemic, we were a site where you could go they could come and pick up their packets for school.
Oh, yes.
Any need that comes up in our communities.
Yeah.
We're just very community oriented.
Yeah. So you're really the front door to healthcare for a lot of people in your community.
Exactly.
Yeah. So accessible, affordable, high quality care. Get to know your pharmacist. Yeah. Can you talk about, you are a business owner. So talk about the journey to being a business owner.
When I came out of pharmacy school, I worked at a grocery store chain, and I really liked it. It allowed me to really get in and see how it was to be a pharmacist and be a community pharmacist, and where the need was. But I knew I always wanted to own my own. And I randomly met my business partner, who his name is Greg Bassey, and he was opening a pharmacy in Hillsborough, and I lived in Hillsborough, and I said, "You're stealing my dream. What are you doing?" So things fell into place, and we partnered together and started the pharmacy, going on 12 years now. So I had to learn on the fly all the business aspects, and I was able to have a great partner who was very business oriented. And the program that you have with the pharmacy school now, that you can get an MBA as well, is amazing. I wish that I had that when I was there, because it's so essential. It would have helped my stress levels out a lot back then, but we made it through. And so a lot of on the job training, a lot of trial and error. I always lean towards, is it going to be what's best for the patient, what is needed in our community? But then I have to take a step back as a business owner, say also what is profitable, or at least able to be maintained. That's been definitely a learning curve for me, is the business aspect. So I would encourage anybody who is leaning towards that to do the dual program, because I think that's an excellent opportunity.
So can you talk a little bit about IndyCare and how that works and what it is?
Yes.
Yeah.
So IndyCare is our answer to the help hub within pharmacies. We know that pharmacies are frequented more than doctors' offices. We have almost 10 times the point of contact with them, but we're limited in what we can do because we are on a different insurance billing mechanism as far as medical billing. So this was kind of our answer to that. IndyCare is a urgent care on its own, so it kind of is funded by itself. With we have 2 nurse practitioners and then usually a medical assistant, and so the urgent care part of it is usually what funds it. But then on the other side, we can also bill medical services for the pharmacy in whatever we decide is going to work in that area.
Mm-hmm.
A lot of the things that we as pharmacists do every single day, we just don't bill for them. It's a documenting and billing platform to get paid for what it is we do. So all of our counseling, all of the time that we spend on patients, and this is time that's not captured. Typically, pharmacists, we just do that because that's what we've always done.
Yeah.
But that being able to capture that time and to be able to bill for that time just as any other provider would, we were able to really expand our services for testing, test to treat. Mm-hmm. Of course, our immunization program, testing for flu, COVID, RSV, smoking cessation. So now we're looking at more into how can we build that as a preventative service through IndyCare, and for us to get paid for that consult so the patient doesn't have to pay out of pocket. So it's still a very I think that we always think as pharmacists that once we're providers it will change everything for us. And yes, we need to be recognized as providers because we provide so much care. But there's also still medical billing that comes with that and all the other stuff that comes with that. And I think IndyCare has really given us a leg up on when that happens, when we have provider status, what it is we would be able to do and all the things we'd be able to accomplish to be able to bill for the services that we already provide.
Yeah. And I love that you mentioned prevention because prevention really is medicine and that's the best way to save healthcare dollars and keep people healthy.
Exactly. And all these things that we passed in the legislature to be able to do, to be able to not only dispense but prescribe as well, all of these are preventative services and they're so needed in our community.
Right. Yeah, that's really terrific. Tiffany, it was wonderful to talk to you today. Thank you so much for coming by.
Thank you for having me.
Yeah. And I want to thank you all as well for watching. We love sharing our stories of those who make the UNC Eshelman School of Pharmacy excellent. We hope you will join us for the next episode of UnSCRIPted, conversations with people who are advancing medicine for life.